When you're over 60, high blood pressure isn't just a number on a screen. It's a silent signal that your body is under stress. For many seniors, it creeps up quietly, without any big warning sign. Until one day, there's a dizzy spell, chest pain, or worse, a trip to the ER. And while medications can help, there's a powerful truth that often gets ignored. What you eat every single day could be making your blood pressure worse, or better. Let me take you into the story of Mr. Arjun, a retired school principal who had been taking his daily blood pressure pill for 12 years. But one morning, after getting up too fast, he collapsed in the hallway. His family rushed him to the hospital, only to find that his BP had spiked dangerously. The doctor said something strange. It's not just the medicine that matters. We need to look at what's on your plate. That conversation changed everything. And today, I want to help you avoid what Mr. Arjun went through by showing you 3 common foods that many seniors eat regularly, not knowing they're secretly pushing their blood pressure higher. Let's start with the first one, and this might surprise you. 1. Pickles and achar. Salt trap in disguise. Yes, that little spoon of achar that adds flavor to your meal is actually loaded with sodium, the #1 enemy of healthy blood pressure. Just 1 tablespoon can contain over 500 milligrams of sodium, which is already 25% of your daily recommended limit if you're over 60. Why is this a problem? As you age, your kidneys don't remove sodium from the blood as efficiently. This causes fluid retention, which raises your blood volume and puts more pressure on your artery walls. The result? Elevated BP and strain on your heart. What's worse, many store-bought pickles and chutneys are loaded with preservatives and MSG, making them even more harmful. Better option. Try fresh, unsalted herbs like coriander chutney without salt, or use a dash of lemon juice and roasted cumin to add flavor. 2. Bakery items. The hidden sodium bombs. You may think a biscuit or a slice of bread is harmless, but most bakery goods are loaded with hidden salt. Even sweet pastries often use baking soda, baking powder, and salt in the dough. Here's the catch. These refined carbs not only spike your blood sugar, but also increase inflammation, both of which worsen high BP. Let's talk about a real case. Mrs. Shalini, 67, who loved having a toast with jam every morning. Her BP wouldn't go down despite her meds. When her doctor reviewed her diet, he found out that 2 slices of white bread with butter and jam were giving her almost 700 milligrams of sodium and causing early morning blood pressure spikes. Better option. Switch to low-sodium whole grain options. Or better, make fresh millet or oat rotis. They're blood pressure friendly and packed with fiber. 3. Processed meats. Sausages, ham, and salami. Now you might say, we don't eat these daily. But even the occasional consumption of processed meats, especially in sandwiches, frozen meals, or party snacks, can raise BP. These meats are preserved using nitrates and lots of sodium. Some even have 900 to 1,200 milligrams of sodium per serving. And here's what makes it worse. They're low in potassium, the mineral your body needs to relax blood vessels and balance sodium. If you're someone who enjoys frozen kebabs, sausages, or meat slices, especially thinking they're protein-rich, it's time to rethink that choice. Better option. Choose lean, fresh meats, like grilled chicken breast, and combine it with potassium-rich vegetables like spinach or sweet potato. Let's pause here and ask an important question. Why does sodium affect seniors more than younger people? As we age, our blood vessels become less flexible. Imagine your arteries as rubber pipes. In youth, they expand and contract easily. But after 60, these pipes stiffen. When excess sodium pulls more water into your bloodstream, your already stiff vessels can't expand, so the pressure shoots up. This is why many seniors experience high BP despite eating normal amounts of salt. But here's the good news. Reducing sodium can show measurable results within 7 days. One study from the American Heart Association found that cutting sodium to under 1,500 milligrams per day lowered systolic blood pressure by 5 to 6 points in just 1 week. That's like taking a mild BP medication without the side effects. In Part 2, we'll not only look at what else you need to remove from your diet, but also what powerful foods, minerals, and daily habits can naturally lower your BP in a safe and sustainable way. Because for seniors like you, it's not just about living longer, it's about living better. We exposed 3 everyday foods that silently raise your blood pressure: pickles, bakery items, and processed meats. Now let's focus on what you can do to take control of your health, especially after 60, without relying solely on medication. Because here's the truth. Seniors who make the right dietary choices and small lifestyle adjustments often see real improvements in just 7 to 10 days. Let's dive into 3 powerful shifts you can start making today. 1. Add these potassium-rich foods to your plate. Potassium is your blood pressure's best friend. It helps your body balance out the excess sodium, relaxes blood vessel walls, and promotes better kidney function. The problem? Most seniors aren't getting enough of it. Many common senior diets, full of rice, refined carbs, and low-fiber food, lack this vital mineral. Let's look at what worked for Mr. Rajan, a 72-year-old retired engineer. He had been struggling with BP for over 10 years. After cutting back on salty snacks and adding potassium-rich foods like spinach, sweet potatoes, beets, and coconut water, his pressure dropped from 158/92 to 134/84 in just 2 weeks. Best potassium sources for seniors. Spinach. Just 1 cup gives you over 800 milligrams potassium. Sweet potatoes. High in fiber and blood pressure-friendly avocados. Great source of potassium and healthy fats. Beets. Help improve circulation and nitric oxide levels. Coconut water. Natural electrolyte balance. Better than soda. Pro tip. Aim for at least 3 to 4 servings of potassium-rich vegetables daily. But if you have kidney issues, always consult your doctor before increasing potassium drastically. 2. Start the 10-minute walking rule. You don't need to run marathons to control your blood pressure. Just walking 10 minutes after each meal can do wonders. Here's why it works. It reduces the post-meal blood sugar spike, which is often linked to increased BP. It improves circulation and artery flexibility. It gently activates your parasympathetic nervous system, lowering stress. Dr. Bhavna Joshi, a senior cardiologist, shared that her older patients who added just 30 minutes of walking a day, split into 3 parts, 10 minutes after each meal, had lower BP readings within a week. Bonus: walking after dinner also improves sleep, which is another key factor in BP control. 3. Try this simple breathing trick for immediate results. You'd be amazed how quickly a few minutes of deep, slow breathing can reduce your BP. This isn't meditation, it's science. When you breathe slowly and deeply, especially through your nose, you activate your vagus nerve, which tells your body to calm down. This lowers your heart rate, reduces cortisol, the stress hormone, and eases the tension in your arteries. Here's a technique that helped 68-year-old Sunita Devi, who often had BP spikes due to anxiety. Sit comfortably with a straight back. Inhale through your nose for 4 seconds. Hold your breath for 4 seconds. Exhale slowly through your mouth for 6 seconds. Repeat this for 5 to 7 minutes after waking up or before sleeping. Within a week, her morning BP readings went from 152/88 to 138/82, just by adding this one habit. Other senior-friendly habits to try. Drink 1 glass of warm water first thing in the morning. Helps flush sodium. Use herbs like garlic, tulsi, and cinnamon. All naturally reduce BP. Avoid eating late at night. It increases nighttime BP and affects sleep. Now, here's what many seniors get wrong. They try to eat healthy, but fall into the trap of low-fat, high-carb diets. White rice, packaged cornflakes, or sugar-free biscuits can still raise your BP because they spike insulin, which leads to water retention and blood vessel constriction. Instead, build your plate like this: 50% vegetables, spinach, beans, lauki, methi, beetroot, 25% protein, dal, tofu, grilled chicken, eggs, 25% complex carbs, millets, brown rice, oats, and most importantly, check the salt content on everything. Even healthy foods like soups, sauces, or papads can hide hundreds of milligrams of sodium per serving. Let's recap what to avoid. Pickles, papads, achar, bakery breads, and biscuits. Processed meats, salty snacks, frozen meals. Excess rice and sugar-free diabetic biscuits. What to add instead: spinach, sweet potato, beetroot, oats, millets, barley fresh herbs like garlic and tulsi. 10-minute walks and slow breathing. You may feel like it's too late to change, but it's not. Your blood pressure is not fixed. It's responding to your daily choices. And even one small change today can bring relief tomorrow. Thousands of seniors across the world have reduced their blood pressure by simply removing the wrong foods, walking a little more, and calming their body from the inside out. And they didn't need a fancy diet, gym membership, or expensive medication to do it. Just awareness, consistency, and the decision to take back control. If you found this helpful, don't forget to check our next video, where we reveal the best morning drink for seniors with high blood pressure and diabetes. And if you're serious about fixing your pressure naturally, subscribe now and turn on the bell icon so you never miss a powerful health tip. You've got this. Your health is in your hands.